This is a video presentation by Erica Brusso from Regis College. It's called GI Bleeding in Patients with Atrial Fibrillation Being Treated with Anticoagulants. The problem statement: GI bleeding in patients taking anticoagulant therapies for treatment of atrial fibrillation. The background: the Aristotele trial compared warfarin and abaxapan in the history of bleeding with these medications. The trial included 18,140 participants from 1,034 clinical sites in 39 countries who had received at least one dose of warfarin or abaxapan. The background of the other trial that I will be talking about is the Rocket AF trial. In this trial, patients with atrial fibrillation who were taking rivaroxaban and warfarin will be compared. There was a total of 14,236 participants in the trial. The trial assessed their chances of developing a GI bleed. The three domains of nursing that are important. Research. More research still needs to be done for the newer anticoagulant medications. Education. Patients need to be educated about the side effects of these medications and be able to identify signs and symptoms of bleeding that is concerning. Practice. For nursing practice. Many patients are on anticoagulants, so medical professions need to be aware of the common side effects. They also need to be aware of the comorbidities that can put patients at higher risk for developing GI bleeds. This way, they can help prescribe the proper anticoagulants that are the best for their patients. Comorbidities for developing GI bleeds: renal disease, alcohol abuse, reduced platelet count, hypertension, genetic factors, strokes, excessive falls, diabetes, increased age, COPD, sleep apnea, long-term aspirin use of NSAIDs, use of H2 antagonist, and GI bleeding history. The purpose of this investigation was to see which drug is the safest for treatment of patients with atrial fibrillation and less likely to cause GI bleed. Direct factor XA inhibition drugs, rivaroxaban and abaxapan, or vitamin K antagonist warfarin. In the Rocket AF trial, 684 of 14,236 people had some type of GI bleeding event. The patients who were on rivaroxaban had more events than the patients receiving warfarin. 58% were on rivaroxaban and 42% were on warfarin. Here is a chart that shows this. It shows the major bleeding and death within 30 days. And in this, it looks like the abaxapan shows a lower major bleeding after 30 days than the warfarin. Here's another one. And this is for the Rocket AF trial. This showed the patients on rivaroxaban versus warfarin. The other one that I just showed you was for the other medication, the other XA factor. GI bleeding in the AF trial showed rivaroxaban had a higher amount of bleeding than warfarin. The question that is being researched in these trials is which of the medications are associated with more GI bleeds, which anticoagulant is the safest for patients to use to treat their atrial fibrillation. After reviewing these trials, there are still many unanswered questions about which anticoagulant medication has the least potential for a GI bleed. 3 medications were compared, but not in the same study: warfarin, rivaroxaban, and abaxapan. In both studies, it did show more frequent GI bleeds when patients had comorbidities. Also, both studies had a higher occurrence with the male population. Taking a thorough health history is very important for these patients to decide the best treatment plan for them based on their histories. More research still does need to be done about treatments for atrial fibrillation, but we are heading in the right direction. In conclusion, the proper diagnosis and treatment are the key factors to success for these patients. Essentially, what these trials stated is that there's a lot of unanswered questions. The three medications, like I said, were not compared side by side. But in the Aristotle trial, the conclusion is that Apaxapan has fewer bleeding events than warfarin. In the Rocket AF trial, Rivaroxaban has more increased incident bleeding than warfarin. So essentially, the direct XA factor drugs that I mentioned still have a lot of side effects. So does warfarin. They all have some serious side effects of bleeding, and there still does need to be more studies done. Another thing that needs to be mentioned that is not mentioned on this slide is the half-life of the medications. The half-life of Rivaroxaban is 5 to 9 hours in a healthy adult. Apaxapan has a half-life of 12 hours in a healthy adult, and warfarin has a half-life of 20 to 60 hours in a healthy adult. Since there is no anecdote to date for any of the XA factor drugs, they have more likely you can't reverse the bleeding event. Warfarin at this time can be reversed with vitamin K, so there is that to consider when you are prescribing the medications. Thank you. Have a good day.